Would you do me a favor if you're here? Would you go on in the Q&A area and raise your hand and let me know that that option is working? I want to make sure everything is working. Yep, I see you raised your hand. Thank you, Andrew. Glad you're here. Andrew, Inga, Joe, and VJ. Thank you. Yes, you're here. Very good. Raised your hand. All right. This is exciting. And my birthday's today, by the way. I'm 66 today. Just to get a sense, if you're Medicare eligible, thank you, Joe Jordan. Thank you for raising your hand. If you're Medicare eligible, just raise your hand. If this is the question, if you're already on Medicare, just raise your hand so I know. Okay, so 2 of you are already on Medicare. Very good. And if you're just coming on to Medicare or you'll soon be Medicare eligible, raise your hand. Okay, good. It helps me to understand a little bit better because I want this course to be very meaningful for everybody here. Let me just give us a few more minutes. I want to get started right at 2:05 if I can. Oh, it's 2:06. Let's get started. And if you're late, you'll just have to pick up from there. So hello, my name is Martin Cowart, and I am a Medicare insurance representative. I'm an independent Medicare insurance representative. And I wanted to just tell you a quick minute or two of my story and how I got into this business. Okay, let's see what you said here. I meant to raise my hand. Okay, fantastic. You're registered to start Part B on November 1st. Perfect. Absolutely perfect. That's fantastic. Thank you. So we've got a nice assortment of people. And I imagine if you're already on Medicare insurance, you're just kind of wondering, you're here because you're wondering, do I have the right plan or not? And let me give you a little background. I was a traditional financial planner and wealth manager for years. And I worked for a great big company for quite a number of years. And I decided in 2017, for a number of reasons, and I'm really excited I did, to transition from being a financial planner, wealth manager, to being a prosperity coach and teacher. And so now I do more teaching about how to live in prosperity and more coaching than I do financial planning. And when I left, this was a few years ago, when I left, a good friend of mine that I really like a lot said, Martin, you should look at, as you're transitioning into this new role, you might want to look at Medicare insurance because it's a type of insurance that you're aging into, and a lot of your peers could use some help, because it's a very good system, but it's complicated. And I really never knew that much about Medicare insurance, quite frankly. And but it was coming up. It would soon be. I'd soon be eligible myself. So I began to sort of investigate, and I looked around. And I said, this is a good idea. There's more to this than meets the eye. And I never quite realized that. And the more I kind of scratched below the surface, I said, and it sure is complicated. There's so many plans. There's so many options. Someone needs to help people like me figure this thing out. And maybe that's going to be me, because I do understand insurance and how it works. So I went through the process to get certified to be an independent representative. So I'm actually certified to sell products. And I went independent because, as I learned, it's not about the carrier and the plan. It's about the individual. And the reason why Medicare insurance is so complicated is because it's got something for everyone. But when you're looking at it, it can be overwhelming because it does have something for everyone. And you kind of like, well, which way do we go? And what I discovered is it's not about the plan or the carrier. I represent about about 8 carriers, and they're all great carriers. What's most important about finding the right plan is finding the right plan that's right for you. Because you could be, and I discovered that for myself, because you could be, your husband or your spouse could be on one plan that's great for them because that's their medical profile, and that plan's got more benefits that's going to benefit them at the lowest cost. And your spouse might be on another plan that is better for them. One might be on a Medicare Advantage plan, and one might be on a Medicare supplement plan. So as I began to learn and understand the complexities and the intricacies of Medicare insurance, I thought, wow, people need to understand this because it's really a very good program. And all of us have paid a lot of money for it all of our lives. So we darn sure want to get the best bang for our buck. So I decided I'm going to become a specialist, and I'm going to help seniors like myself understand the product and understand how it works so they can be certain that they know they have all the right plans in place for them. And same for myself, because as I began to dig in, the plan and also it depends on where you live, because different carriers have different coverages. So that's the point of me, of what I'm doing here today, because I think we need, as complicated as it was for me to understand, I'm in the business, I couldn't imagine how complicated it could be for those who really don't understand insurance as well as I do as a professional. So that's why we're here today. I want to give you this is how it's going to look. I'm going to show you in a minute about a 15-minute video clip. And in that video clip is going to give you a very broad view of how Medicare insurance works. We call it the ABCDs of Medicare insurance. And I don't think you need to take notes so much as the following. I want you to watch the video from the place of what do I need to know? What questions come up for you? So go get a piece of paper and a pen and write down all the things any questions that come up, because we're going to have some time at the end of this for me to answer your individual questions. And we've got a certain level of privacy. I don't know that anybody can see who you are. Maybe we have a question and answer area, and I know that I want to respect everybody's privacy, and I don't believe you can see each other. I'm sort of new at this technology, but I don't believe if you put something in the Q&A, I believe I'm the only person that can see it. So what's going to happen there in the Q&A section, once we watch the video, you're going to write some questions. You're going to write your questions down. And then when we get to the Q&A section, you're going to post them into the Q&A. And as they come up, I'm going to answer each and every one of them. And what I find often when you begin to answer questions is more questions come up. And that's important. One other person might ask a question that triggers an idea in another person, and that's a good thing, because that's how we learn. We learn by asking questions, and there's no stupid questions. It's a complicated system, because what I've discovered for myself, and I'm on Medicare, I'm on a Medicare Advantage plan, it is a very good program. And you can get some really good insurance, healthcare coverage for really not a whole lot of money. But you got to kind of know what you're doing. And that's what I'm here for. I'm here to help you understand all the secrets, all the ins and outs of Medicare insurance, so that you can be sure that by the time you put something in place, or maybe, also this is a little note for you, those of you who've already got Medicare insurance. Beginning in October, that's called the annual enrollment period. And it's during that period that you can look at your plan, and you can say, oh, I want to look at plans and look at my options again. And I suggest that you do that no matter what. And I'll tell you, we'll talk more about that in a minute, but I'll tell you why. Because every year the carriers change, and the plans change, and the formularies change, and your needs change. So what might have been the very best plan for you last year going into the 2020 season may not be the best plan for you going into 2021. And this is your opportunity to make that change at no cost and no risk. And I encourage you to do that. So this is good for both of you, both groups, those who are coming onto Medicare insurance and those of you who are already on Medicare insurance, because you have a chance to change. So enough for me. I'm going to share the screen with you. I'm going to share with you a short video. You're going to take notes, questions, and we're going to come back and we're going to answer your questions. Does that sound good? Okay, just give me 1 second to set this up. Give me 1 minute here. Share my screen. I'm going to share my screen with you. I'm sharing my screen with you. Here you go.
Hello, and welcome again. Thanks for joining us today for a Medicare meeting. We're here to help you learn more about your Medicare coverage options and ready to walk you through the ABCDs of Medicare. These are the parts of Medicare that will help you put together the right coverage for your own personal health needs and budget. Your host today is a licensed independent broker and is well prepared to answer your questions or provide you with more information on your Medicare options. Let's get started by answering a few important questions. First of all, what is Medicare and who is eligible for it? Medicare is our country's health insurance program for older adults or those with certain disabilities. You are eligible for Original Medicare if you are a U.S. citizen or a permanent legal resident for at least 5 years and age 65 or older and eligible for Social Security, or younger than 65 and have certain disabilities, such as end-stage renal disease. When can you enroll in Original Medicare or other Medicare options? Medicare's enrollment periods include the initial enrollment period when you can sign up for Medicare during a 7-month period that begins 3 months before the month you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. Next, there's an open annual enrollment period, which happens each year from October 15th to December 7th, when anyone with Medicare can join or switch plans. If you enroll during open annual enrollment, your coverage will begin on January 1st, as long as the plan gets your request by December 7th. Another option is the open enrollment period. Between January 1st and March 31st, Medicare Advantage members may make one switch to a like plan or return to Original Medicare, but may not add or remove Part D drug coverage during this time. And finally, there's the special election period for people whose special circumstances allow them to enroll in a plan outside of the other enrollment periods. You can enroll in a plan during the special election period if you retire or lose your employer coverage, move outside of the plan's service area, receive state assistance, have qualifying disabilities or chronic health conditions. So, what are the ABCDs of Medicare? Once you qualify for Medicare, you have options to consider. These are Medicare's ABCDs. Let's call them your Medicare building blocks. You can put the blocks together in a way that's right for your healthcare needs and your budget. Part A and Part B are the foundation building blocks. They are often called Original Medicare. Medicare Part A helps cover hospitalization expenses. Medicare Part B helps cover medical expenses, like doctor's visits and outpatient care. Part C is called Medicare Advantage. The Part C block always includes Part A and Part B benefits, but it may also include extra benefits that you wouldn't typically have with Original Medicare. For example, it may also include Medicare Part D prescription drug coverage right in the same plan. Part D, of course, is Medicare prescription drug coverage. This helps you cover the cost of your medications. And finally, there's a block without a letter. It's called Medicare Supplement Insurance. This policy can help fill coverage gaps and pay for things such as co-payments, co-insurance, and deductibles not covered by Original Medicare. Many people have this extra coverage, but it can be quite expensive. Here's something to keep in mind. If you don't sign up for Medicare Part B when you are first eligible, or if you drop it and get it again later, you may have to pay a late enrollment penalty for as long as you have Medicare. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B, but didn't sign up for it. So, let's see how you can put these blocks together to build the coverage that's right for you. First, you can choose Part A and Part B, or Original Medicare, as it's often called. You'll have your choice of doctors, hospitals, and other providers that accept Medicare. But what about your costs? For Part A, you'll pay a deductible if hospitalized. That's currently $1,316 per benefit period. For Part B, you'll pay a monthly premium of $134 for most people, as well as a deductible of $183 per year. Once you meet your deductible, Medicare pays its share, typically 80%, and you pay the remainder, typically 20%. One thing to keep in mind is that there's no cap or limit on what you could be responsible for paying out of pocket each year when you choose only Original Medicare, or Part A and Part B. What about your medications? If you want prescription drug coverage, you'll need to join a separate Medicare Part D drug plan with a separate monthly plan premium. And if you want extra coverage to help pay some of your copays, coinsurance, and deductibles, you may want to buy Medicare supplement insurance from a private company. That's another separate policy with separate monthly premiums. Plus, it doesn't include your prescription drug coverage, which means you would need to add a Medicare Part D plan with a separate monthly premium. It all starts to add up, but you have another option. You could choose a Medicare Advantage or Part C plan, such as HMO or PPO. Remember, Medicare Part C includes Part A, hospital, and Part B, medical. It often includes Part D drugs, too. Plus, extra benefits or services not covered by Original Medicare, such as vision or dental services. In most plans, you'll use the plan's doctors, hospitals, and other providers, or you may pay more or all of the cost. You may pay a monthly premium for your Medicare Advantage coverage, in addition to your Part B monthly premium, which you continue to pay. Many plans have low monthly premiums. You'll have copayments or coinsurance for all your covered services, which vary by plan. There are other advantages of Medicare Advantage plans. They are offered only by private insurance companies that have contracts with Medicare to provide these services. There's a yearly limit on what you could pay out of pocket, so you're protected in the event that you have a significant health situation and expense. And you avoid the added cost of a Medicare supplement plan. Think of Medicare Advantage as all-in-one Medicare coverage. So you can see, there are different ways to get your Medicare coverage. Use your Medicare building blocks to get the coverage that fits your healthcare needs and budget. This is quite important, so let's review it again. You can choose Original Medicare, Part A and Part B, and stop there. Or you can add a Medicare Part D prescription drug plan for an additional monthly premium, and maybe even a Medicare supplement policy to cover gaps in expenses not covered by Original Medicare. Medicare supplement policies can cost $200 to $300 per month, or $2,400 to $3,600 a year upfront, meaning you pay this additional monthly premium regardless of whether you need the added coverage. Or you can choose an all-in-one Medicare Advantage plan, or Part C, that rolls together Medicare Part A and Part B, and usually Part D, drug coverage, plus additional benefits and services, which vary by plan, into a comprehensive all-in-one Medicare plan. The plan comes with a yearly limit on what you could pay out of pocket. Many Medicare Advantage plans have $0 or low monthly premiums, and you will not need a Medicare supplement when you select a Medicare Advantage plan. Not surprisingly, with all these advantages, Medicare Advantage is growing in popularity. Enrollment in Medicare Advantage has increased 33% from 2010 to 2017. It now accounts for 19 million people in the U.S. Almost one-third of all people with Medicare choose Medicare Advantage. Of those people enrolled in Medicare Advantage, 90% are satisfied with their plans, 94% are satisfied with the quality of care they receive, and 90% are satisfied with the benefits received in their Medicare Advantage plan. So what are the top reasons people choose Medicare Advantage plans? Coverage. Medicare Advantage plans typically offer more benefits than Original Medicare. Plus, they often include Part D coverage, so you have all the coverage you need in one plan. Cost. The costs of monthly premiums, deductibles, and copays may also be more affordable than other options. Remember, there's a limit on yearly out-of-pocket expenses, so your wallet is protected. Convenience. Medicare Advantage plans offer all-in-one convenience for your medical, hospital, and depending upon the plan you select, drug benefits in one plan. Care. Medicare Advantage plans collaborate closely with your doctors, nurses, and specialists to make sure you get the care you need when you need it. Let's make sure that you understand the basics of Medicare Part D prescription drug plans, too. This information pertains to both standalone Medicare Part D plans as well as Medicare Advantage prescription drug plans, often called MAPD plans. How much will you pay for Part D coverage? Your drug plan costs will vary depending on the plan you choose and the monthly premium and cost-sharing amounts required. Your prescriptions and whether they're on the plan's formulary, which pharmacy you use, whether it offers preferred or standard cost sharing, is out-of-network or mail order, whether you're enrolled in a program to help cover your Part D costs. This is important to know. You may have to pay a late enrollment penalty if you don't join a Medicare prescription drug plan when you're first eligible and you decide to join later. The cost of the late enrollment penalty depends on how long you went without what's called credible prescription drug coverage. This is prescription drug coverage, for example, from an employer or union that is at least as good as Medicare prescription drug coverage. Most Part D drug plans charge a monthly plan premium. You pay this in addition to your Part B premium. If you're in a Medicare Advantage plan with Part D drug coverage, your monthly Medicare Advantage premium already includes your Part D premium. Your Part D coverage has 4 stages each year, and your costs vary from stage to stage. Stage 1 is your yearly deductible. This is the amount you must pay before your plan begins to pay its share of your covered drugs. Some drug plans don't have a deductible. Be sure to check this. Stage 2 is the initial coverage stage. You pay only your copayment or coinsurance for your drugs. Stage 3 is known as the coverage gap. After the total amount of your drugs, paid by both you and the plan, reach $3,750, you enter the coverage gap or donut hole. You have to pay for your drugs until your total drug costs reach $5,000. The good news is that the Affordable Care Act shrinks the donut hole little by little each year, until it is eliminated entirely in 2020. Stage 4 is called catastrophic coverage. If your total drug costs are higher than $5,000 for the year, you enter the catastrophic coverage phase. In this stage, you pay a small copayment or coinsurance for your drugs for the rest of the calendar year. You should also know about drug formularies and tiers. A formulary is just another name for the list of brand names and generic drugs covered by a plan. Be sure to check the formulary for any plan that you're considering to be sure your medications are covered. And drug tiers are just a way of organizing a formulary's covered drugs into smaller groups, or tiers. Drugs in each tier have a different cost. For example, a drug in a lower tier will generally cost you less than a drug in a higher tier. Some covered drugs have additional requirements or limits on coverage. If you or your prescriber believe that a coverage rule should be waived, you can ask for an exception. The types of coverage rules a plan may have include prior authorizations. This means that you or your prescriber must contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for the plan to cover it. Quantity limits. These are limits on how much medication you can get at one time, and step therapy. In some cases, you must try one or more similar, lower-cost drugs before the plan will cover the prescribed drug. Finally, people with Medicare have rights and protections which are good to know about. You have the right to ask the plan to provide or pay for items or services you think should be covered, provided, or continued. This is called an organization determination. You have the right to request a review of certain decisions about healthcare payment, coverage of services, or prescription drug coverage. This is called an appeal. You have the right to file a complaint, including complaints about the quality of a plan's care. This is called a grievance. Medicare Part D and Medicare Advantage plans are required to have appeals and grievance procedures. They are designed to protect you. Your rights and protections are explained to you in the Evidence of Coverage document for your plan. The Member Service Department at your plan also can help explain them. Now that you understand your Medicare options and know how Medicare Advantage plans work, how do you know if you're enrolling in the right plan for your situation? Talk to your doctor. Your doctor will know which plans are easy to work with and do the right things for their members. Talk to an expert. Licensed agents like ours work in your local community and are specially trained to help people like you understand your Medicare choices. It's their job to help you find the right coverage. Finally, look at Medicare Star Ratings. Medicare evaluates plans based on a 5-star rating system on things from member satisfaction to how well they keep their members healthy. The more stars a plan has, the better it has scored in those categories. Look for a plan with higher star ratings. Before we wrap up and turn the program back over to your host, let's review what we've covered. So far, we've discussed the ABCDs of Medicare. Remember, our Medicare building blocks and the various ways that you can put these blocks together to build the coverage that's right for you. Medicare Advantage and why this relatively new option is gaining popularity. Medicare Prescription Drug Plan Basics, and Medicare Rights and Protections. We also talked about when you can enroll in Original Medicare or other Medicare options. You can do this during the initial enrollment period when you turn 65, or during the open enrollment period each year from October 15th through December 7th. You can also enroll or make changes during a special election period if you qualify. Thank you again for attending our Medicare meeting today.
So, what did you learn? Someone, Jordan, let's see, Joe, Jordan, you got your hand raised. Let me see if I can give you ability to talk. I think you can speak now, Joe. You want to ask me a question? Is your, you got to turn your audio on because I have given you permission. If you can't, if you don't have audio, oh, it is a lot. Yes, it's a lot of information. It's a lot of information. It is a tremendous amount of information. Do you have audio? Do you have ability to speak? So I've turned that on for you because maybe I can help you understand it a little bit better. That's why I'm here, because there is a tremendous amount of information being thrown at you. That's Andrew. Andrew just said that. It's hard for me to read. Andrew, let me give you ability to speak. Hold on. Andrew?
Yeah.
Go ahead and there's a lot of information here. What would you like to know in particular? How can I break it down and make it simpler for you?
Okay, well, I've registered for Part A and B. I have to make a choice soon regarding either an Advantage plan or Part C and D. I'm not sure how that's going to work. But how do I apply for either one?
Well, you apply to a private carrier. There also was one. You can speak to me or someone like me, an independent representative, and I can take you through the steps.
Okay.
And maybe that's a good question. Maybe I should back up and answer that question for everybody. The way you can apply for insurance. There's a lot of ways. One thing you can do to find out which carrier is right for you is you can go to Medicare.gov and you can create a medical profile for yourself. But you put in your doctors, your primary care physicians, your specialists, and all your prescription drugs, and create a medical profile. You want to start with your medical profile. And one option is to go to the Medicare.gov website and put that information in and run a program and say, find me a plan. and they will find you all the plans in your area. They'll find you all the supplemental plans, and it will find you all of the Medicare Advantage plans. The problem with that is it's going to find you all of them. So now you got to figure out, of all these plans, which one is right for you. You're still stuck with the same dilemma like you are now. It's a lot of information. And you got to determine whether do you want a supplement plan or do you want a Medicare Advantage plan. So basically there's two paths to cover that 20% gap, because original Medicare just covers 20% and it does not cover prescription drugs. So this is what you're trying to figure out. We're trying to figure out which plan, which path is best for you or anybody to get that 20% covered. And you got two options. One of them is the supplemental option and a prescription drug plan, standalone plan. So that's one option. The problem with that option is those can be quite expensive. They cover everything, you don't have to worry, but they can be quite expensive. $200 to $300 a month on top of your plan B. And you may not need that much coverage, which is why a lot of people prefer the other option, which is Medicare Advantage. And the Medicare Advantage plan is a low cost premium, sometimes often zero premium, but really low, usually typically less than $100. I think mine's $36 a month. You pay a very low cost, and it covers most of your basic stuff. Like, for instance, your generic drugs, if you're like if you got high blood pressure and your generic 1 and 2 often are covered for free. So it provides you a very low cost alternative to getting your particular needs met without a whole lot of cost to you. Now, inside the Medicare Advantage plan coverage, there are two options. Again, we're not looking at supplements. We're looking at Medicare Advantage Plan C, which typically do include the drug coverage. Now, you have two options of how you want to see your doctors. You have two plans where you want to see. One of them is an HMO, and one of them is a PPO. Now, an HMO is going to require you to go into their network and not have a lot of options outside of your network. And I rarely put anyone into an HMO plan, because you can get a PPO plan for no more money and have a lot more options. Because in a PPO plan, you're not restricted to just the participants in their plan, nor do you have to have a referral to see a specialist. If they're in the plan, you get to go. And that's typically the best option you got out there. But not for everybody, but typically a Medicare Advantage Plan C with Part D coverage in a PPO plan is typically the best plan for you if they have good coverage in your area. Does that make sense? Now, so you can go to Medicare, you can go to Medicare.gov and you can run all this and you can get that. Or I'm gonna make it simple for you. I'm gonna give you my email address and access to my calendar. If you like, you can set up a time with me. You can write to me, and we can go over in private. We can go over your particular Medicare profile, and I can help you cut through all that and help you find the plan that's right for you. That's one of the big benefits for me being an independent. If you called United Healthcare, for example, and spoke to them, I can guarantee you they're going to sell you a United Healthcare coverage, whether that's the right plan, whether that's the best plan for you or not, because that's who you're talking to. The advantage of talking to an independent like myself is I'm licensed with all these carriers. So my whole agenda is nothing more, and I don't cost you anything, and it doesn't cost you anything to use an independent. And I would highly recommend that you do that, because that Medicare ultimately pays us to help you find the right plan. So it's in your best interest to hire an independent Medicare insurance representative to help you find the plan that's right for you, because it doesn't cost you anything. And I'm personally inspired to want to make sure you have the right plan, but we're also legally obligated to help you find the right plan. So you got everything going for you. And that's the purpose of this seminar, is to hopefully get you to know me and me get to know you, so that you'll want to call me and get my help, because that's really the best way to go. And I don't know which plan is best for you. And let me tell you how that would look. You call me on the phone, and we're going to go through, and we're going to look at your primary care physician. We're going to look at any special doctors that you have, and we're going to look at all your prescription drugs that you're currently taking, and we're going to create your medical profile. Then we're going to take your medical profile, and I'm going to run it through the software that we have of all the carriers and in your area code. And then we're going to determine, and it's going to come up with all the different plans in your area. And then we're going to decide whether you want to go with a PPO plan or do you want to go with an HMO plan. And then what's going to might decide that is where your doctors are. We want to find a plan where your doctors are already in there, where your specialists. We want to create as little disruption as we can in your current coverage, so you can get to all your doctors and all your prescription drugs at the lowest possible cost. And every year you want to look at that again. So for those of you on the call, you may be in a great plan, as you saw here, beginning October 15th through December 7th. You might want to call me as well and say, this is what I've currently gotten. I like it. I got my doctors and I'm happy with it. I'm like, okay, let's take a look at it. And we'll look at that. Well, what are the changes to that plan in 2021? And they may not be any of any significance, or they might be. So then we might say, well, Aetna, let's say you have Aetna, for example. Let's just make up an example. Let's say you have Aetna and you're really happy with your doctors and your prescription drug covers. And then for 2021, there's a new player on the block. Let's call it Clover. They're new in New Jersey, and they're very aggressive. They may have a better plan for you than the one you currently have. So you can switch. And it doesn't cost you anything. There's no risk. You just move from one plan to the other. But you wouldn't switch unless it was meaningful for you. If you like what you have, and it may. Typically, I'll tell you this. I always tell people to take a look at it, but most of the time, I tell people, I'll always tell you, if you got the best plan for you, I'm going to tell you, don't touch it. You got the best plan. You don't want to mess with this plan. It's a good plan. You've been paying for it. You like it. You got good doctors. It's if it's not broken, don't fix it. Keep it. But if we discover that there's an alternative that's better for you and lower costs and better coverage, then you might want to consider changing. And then I help you through the enrollment process. I guide you through that. And you might wonder, well, who pays me? Well, ultimately, who pays me is Medicare. Medicare will pay me through the carrier a commission. That's how it works. So there's no out, and the cost of the plan is the same whether you buy it directly from the carrier or you buy it through me. But what you get if you get it through me is you get an independent person without a bias to help you find it. And you get my help during the year too. Let's say you're having a problem with I had a client call me and say they're having a with one of the drugs they wanted to cover, and I was able to plan for them and get in touch with the carrier and find a way to get the drug for them at a cheaper price. So you get a lot of services from people like myself for no cost to you. There's an added benefit to it. Did that answer your question? Good question, because I think everybody probably has it. I'm currently on Emblem Health Medicaid after being laid off from my job so you're on both what's called a dual plan. I've seen ads from United Health and some others saying that if I'm eligible for Medicaid and Medicare, yes, there is. Would this be a good option? Is there a downside? What is eventually? Well, yes. There is no downside. If you're now, I'm assuming you are now coming on to your, is it true that you're currently now Medicare eligible and you've just been Medicaid eligible in the past and you're now Medicare eligible? Okay, perfect. So what we'd want to do there is we would want to look at, we would do a special review of your needs. And we would look at all the carriers, and not every carrier does. It's not just United, by the way. I'm sure Emblem has one. Every carrier is different in what they offer, but they're called dual plans, meaning that they cover both they combine Medicare and Medicaid together, and they typically include it. It's called a dual advantage plan, and it's a great way to get coverage, and there is no downside. But in that case, you definitely want to call me, because trying to find the right plan with all those various options and complexities is a little confusing, even for me. And I do this every day. So I would highly recommend that you take me up on my offer and send me an email or get on my calendar and let's have a conversation, because that is definitely an option you want. But I don't know which carrier would be right until we looked at, again, exactly what your needs are. But yes. That help? Okay. Any other questions? Anybody else? Anybody have a question about what's known as the open enrollment period? I see that you're going to be eligible as of November 1st. And I don't. We could go ahead and review your needs and your options now, and we could find what you need, and then you apply, and then as of November 1st, you'd have what you needed. How about those of you who? Any other questions, Andrew? Good. Okay. How about some of you who are already on Medicare and might want to? Do you have any questions about what's called the annual enrollment period coming up in October? Have you ever gone through a review and during the annual enrollment period just to see if your plan is the best option for you? Do you understand the benefits of doing that? I'm going to open up. Everybody can talk if anybody wants to talk here. I just opened up I see you don't, not everybody except Andrew has on your microphone, but if anybody wants to talk or you want to chat, put your questions in the Q&A. I'll be happy to answer them. I can't believe you don't have more questions. Everybody has more questions. After that, you don't have any questions. Well, I'm here for you. I'm going to give you, I'm going to share my screen with you and give you how you can get in touch with me. It's very simple. It's my email address. So just send me an email, and you'll probably get some follow-up emails with that as well. If you want to have a more in-depth conversation, it's more personal to you, I highly recommend you do that, because that's what I'm here for. Let's see. No. Well, whether you're on a dual program or not has nothing to do with Medicaid eligibility. Medicaid eligibility has to do with Medicaid eligibility. If you're eligible for Medicaid, you will always be able to get a dual plan. If something shifts, if something changes in your situation, and you are no longer Medicaid eligible, then you'd have to switch over to a Medicare plan, a non-dual plan. But it doesn't have anything to do with um, the plans themselves. It has to do with your eligibility with Medicaid. I mean, they're designed specifically for that thing. Yeah, it does. Thank you. Thank you. It makes a lot of sense. I think Joe Jordan, did you have a question? Yeah, if you got recalled for work, you would, whatever. I don't really, I'm not a Medicaid specialist, so I'm not exactly sure what the requirements are for Medicaid. Where I pick up the ball is if you are on Medicaid, then I'm going to look at, I'm going to approach it from a standpoint that, okay, this is the kind of Medicaid you have. This is your plan. I'm going to go out in the workforce and I'm going to find the Medicare plan to attach to that. If that makes sense. I'm going to say, okay, here's a guy who's got Medicaid. He's had it for years. This is what he's currently got. I'm going to go out and look for the plan of Medicare that we can put on top of that to get you the right dual coverage. And if for some reason, whatever that might be, and I don't know what that is, if the Medicaid were to evaporate, then you would no longer be eligible for a dual plan. We'd have to go out and find you a Medicare plan, a single Medicare plan. Then if you became eligible again, you could go back to a dual plan.
Can you hear me now?
Yeah, I can hear you now.
Okay. I'm wondering, we signed up for Medicare last year, and we have an Advantage plan. The
Correct.
person was telling me that if we sign up for that, we won't be eligible for other plans like F and G and all those other letters. I don't understand what the difference is.
That's a great question. Okay. And that's where a lot of confusion is. And what they're telling you is correct. Those letters, F and G, those are the way you look at supplemental plans. So you can't be on both a Medicare Advantage plan and a Medicare supplement plan at the same time. You have to be on one or the other. So either I'm on a Medicare Advantage plan or I'm on a Medicare supplement plan. You can change during the annual enrollment period. You can go from one to the other. Now, the problem with going from a Medicare Advantage plan to a supplemental plan are twofold. One, depending on where you live, they could have underwriting requirements. Two, it might be kind of expensive because remember, the Medicare supplement plans cover everything, but they can cost you $200 or $300 a month. So you could be spending anywhere from $2,400 to $3,600 a year just on premiums. I would imagine if you've got a Medicare Advantage plan, your premiums are pretty low.
Zero.
Right. And are you getting are you having any problems with it? Are they paying for all your doctors and all your prescription drugs?
Yeah, so far everything's been good, but it's only been a year. What happens when we get sick?
Well, that's what they should have covered when if you get sick, you should know exactly what's going to happen when you get sick, quite frankly. I don't know who you're with, but you should know exactly what's going to happen if you get sick. You should know exactly what if you go in the hospital, for example, in your Medicare Advantage plan, you should know exactly what they're going to cover. And if you don't know, give me a call and we can look at that during AEP and we can find you, because you should know that.
Huh.
You know exactly what they're going to cover when you get sick. There should be no mystery in that question. And the fact that you're telling me you don't know, that concerns me.
Me too.
Yeah, because you should know. You should definitely know. You should know what the caps are. You should know, how much your hospitalization is going to be, et cetera, et cetera. There's a difference between is it a co-payment or is it a co-insurance payment? A lot of carriers, this is something I tell you, I'm going to tell you some secrets. Do you know the difference between a co-payment and a co-insurance?
No.
Well, co-payment says if you go to the doctor, you're going to pay $10. That's a co-payment. Or you're going to pay $35 to go see a specialist, let's say. That's in your contract. It'll tell you very clearly. If you go to the doctor, if you go into a hospital, you're going to pay a copay. It says you're going to pay, I don't know, $500 for the first 5 days. That's a copay. Or a co-insurance might say you're going to pay 10% of your hospital stay. That's going to be a lot more expensive. So that's what you got to pay attention to, is that, you know, what is your plan going to pay in case you go to the hospital? And you want to know that, and that you want to know that going into the program. You know, you want to know. That's the question. That's a good question, and I'm glad you're asking me. And the good news is that AEP is coming up around the corner, and we can look at that. I can help you look at that, and we can say, okay, this is exactly what you're going to. This is exactly what the carrier is going to pay for you if you go in the hospital.
Okay.
And that's why it's so important, I think, to look at, and that's why you have AEP, and then you look at it again next year. Maybe the plan, because the plans change every year. And again, I'm gonna put up on the screen in a second. I'll put it up right now, as a matter of fact. Let me put up on the screen for you. You can see it. That's my email address. Martin@martincowardinsurance.com. If you'll just send me an email and say, I'd like to meet with you, I'll be happy to meet with you. I mean, that's what I do. That's my job, is to help you answer that question. And we look at it and say, oh, well, I've got a really good plan here. I say, well, you do. I think you should keep it. Or, you know, this is not the best. This plan over here is possibly better, and these are the reasons why. Because it tells, over this plan, if you got to go to the hospital, they're going to pay $1,000, and you got a $1,000 deductible. If you go in this plan, you have no deductible, and it's going to cost you $500. You see the difference? And that's my job, is to make sure you understand that going into the plan, not months later.
Yeah. Okay. Yeah. I'll get in touch.
Yeah, I'd love to. I'd love to meet you. Where are you located? Are you located in the area?
San Diego.
Okay.
San Diego.
Good. I'm licensed. I am definitely. I've never refused my Medicaid plan. I don't know what that means. Are you on Medicaid or Medicare, Joe? Sorry, I just saw I have never refused my Medicaid plan. I don't know what that means exactly. You mean Medicare or Medicaid, Joe Jordan? Inga, did I answer your question?
Yes. Yes.
I'm really glad.
Thank you very much.
How is San Diego out there today? How is it out there?
Oh, smoky.
Well, yeah, you got your fires, I guess, huh?
Yeah. Yeah.
Okay. Joe, you got a question in the chat. I'm not quite sure how to answer. I have never refused my Medicaid plan. I don't know what that means. You've never refused it. You could be a little more. Does it mean you've never used your Medicaid plan, or are you talking about a Medicare plan? If you're on Medicaid, I can't imagine you not using it. That's the only way you can. If you're on Medicaid, that's the only way you can get your health coverage. So, and again, that's part of the confusion. Some people don't know the difference between Medicaid and Medicare. Medicaid is a way of getting medical insurance for people who don't have the financial means to pay for it themselves. Medicare is a plan that everybody is eligible for once they turn 65, regardless of whatever their financial situation is. VJ, I haven't heard from you. You got any questions for me? I love to answer questions. Well, I'm here. Oh, I got it. I reviewed my Medicare plan. Then I think that makes sense. That's okay. I got it. Thank you, Joe. Yeah, if you haven't ever done it, give me a call. You got my email. Send me an email, and we'll review it together. You know, I'm in this for the long haul. I want you to go to bed at night knowing you've got the best plan in place for you right now. That's my only agenda. And that's what we want to do. So yes, we'll take care of it. Very good. Thank you, Joe. And anything else? Well, this has been a, I gotta be honest with you, this is my very first time doing this live webinar on like this, and it's been fun, and thank you for being part of my very first, getting the technology and being able to do this has been a little challenging for me because I'm not all that technical savvy, but I'm learning. And so thank you for being patient with me today as I'm learning how to navigate Zoom and screen sharing and those kind of things. I'm much better at understanding Medicare insurance than I am Zoom technology. So I want to thank all of you for your patience today. And I hope to hear from you soon. Unless there's any other questions, we will sign out, and I'll look for your